My name is Peter Hoy, and I'm with a group from Ithaca, New York. We call ourselves Potluck for Politics. We are a local grassroots organization that's advocating for single-payer health care. We really feel that health care should not be something that anyone should have to struggle with in the United States. Single-payer is really the only way to go with this. It should not cost people money to be healthy in a country like the United States. That's just, it's capitalism at its unbridled worst.
My name is Chris Sauter. I'm a registered nurse, and I am here today because we want to tell WellPoint and Blue Cross Blue Shield and all of the for-profit insurers that we are tired of their policies of denial, of denying care and manipulating policies so that they pay the minimum amount for what doctors order for patients. We have demands that we want them to also stop running Washington and writing the health care plans which benefit only health insurance companies and not people. We want people before profit, and that is the bottom line of why we are here today.
This is part of a nationwide mobilization of actions at insurance companies that have been taking too many profits, in our opinion. It's part of a group called Mobilize for Healthcare for All.
Okay.
And I have this, which I can give you later, a website if you want to check that. Okay? We're planning to walk either through the building or around if you're more comfortable with that, and to go across the street to 400 South Salina. And there is a letter that they would like to have delivered to the WellPoint. WellPoint is really the medical, was it a National Medical Service or something over there? They contract with Medicare to do all the processing of claims. They're really the people we want to talk to. So we have a letter to deliver.
Do you have anybody in mind you've spoken to deliver this letter to?
We have a person that's the head of WellPoint. What we probably all can hope for is just some supervisor comes down and takes it from us. We don't know who that supervisor is. We tried to find out. And so there is a form, there's a phone in the lobby that gets you security. The 3 elevators to WellPoint are carded. You just can't go up them. So there is a phone to get a security person, and I assume if we call that person and we say we need to deliver something to whoever is your
I can try to arrange that.
Oh, well, bless your soul.
Well, I'll tell you this much information. The building is very, very secure.
Yes, yes.
They're not really allowing people in.
Yeah.
So
how can we deal with that then?
I can try to get somebody to come down and meet with whoever, if they'll accept the letter.
My name's Howard, or Howie Hawkins, and I live here in Syracuse. And I'm intending to deliver this letter to WellPoint and Excellus because we want them to take the profits and high salaries they're making and turn that into care. And we're sitting in because these private insurance companies deny care as a matter of policy in order to boost their income. And I think that's criminal. It ought to be outlawed. What we really need is a real public option, which would be Medicare for all. Healthcare ought to be a public service and a right, not a commodity you have to buy or die.
Not healthcare, not healthcare. Well, profit.
if you intend to get arrested, if there's something we can negotiate, because we certainly don't want to arrest you.
People die.
Look, if they don't take the letter, yeah, I'm gonna get arrested.
Can I ask you how that's going to happen?
May block the door, try to go in. Then it's up to you guys. I'm not gonna wrestle with you.
I don't.
Tell me under arrest.
Arrest you. I understand that.
Yeah, well, but I want to make a point. So,
I know that.
and so if it comes to that, I'll come along. As soon as you tell me I'm arrested, just tell me how to behave. But don't use a come along hold or any of that on me, because I'm not going to wrestle you. Well, okay, good.
You want to think about it for a minute?
Yeah, I want to think about that for a
I mean,
minute.
I really tried my best to negotiate with them.
I
appreciate
I'm
that.
having a little bit of difficulty making any headway. Nobody here can really accept the letter.
This is
you
a
know?
common plan
Sure.
all over the nation. West Point has stopped accepting letters, and people have been sitting overnight.
Okay. Well, they really, to me, it looked like they were thinking about it for a minute. And
Okay.
that's why it took 10 to 15 minutes
Yes.
there.
Okay.
But we just come to an impasse apparently where we cannot.
Okay.
They're not
Maybe
gonna
they got
accept the
some
letter.
word. You know, who knows?
Accept the letter.
Yeah.
okay. Well, let me think about it for a few minutes, and
Well Point profits.
I'm sure you guys are in no hurry. You're on the clock, so
Okay.
all right.
Thank you.
Well, we got 4 basic demands. One is that WellPoint stop spending on lobbying, political ads, and campaigning against welfare reform, and use that money to pay for doctor-requested treatment for member patients with life-threatening illnesses. Secondly, we're going to stop denying approvals for life-sustaining medication for Medicare recipients. We want them to stop rewarding employees for denying coverage to sick patients. And basically, the 4th demand is they're going to continue to deny benefits to people for corporate profit. We're saying they should fold up shop and quit. WellPoint and Excelis, which are located at this building, as a matter of policy, deny care to patients to boost their income. That ought to be a criminal enterprise, not something the government's about to subsidize with so-called health care reform, which they call the public option, but it's really the corporate option. And they're going to make people buy insurance. The government's going to subsidize some of that insurance. It'll swell the profits of the insurance companies, and all they'll do is invest it in the stock market. So it's a bailout for Wall Street as well as subsidies for insurance. And the people are not going to be able to afford their health care. They'll still have, because of managed care, they'll have to fight to get the coverage they think they're entitled to. And we're mad about that.
So it's your intention?
Medicare for all.
Go Howie! Go Howie! Go Howie! Go Howie! Go Howie! Go Howie! Howie for healthcare! 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 Howie for healthcare!
Well, points for real criminals.
Arrest WellPoint! 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 Points for real criminals! WellPoint's the real criminal! WellPoint's the real criminal! WellPoint's the real criminal!
My name is Briggs Seekins. I'm here with Single Payer New York today at Syracuse outside the WellPoint Excellus offices to protest the for-profit insurance company industry. When I was 19 years old, the United States of America spent a lot of money to send me to Iraq, to the Persian Gulf region, for Desert Storm to fight an enemy that I don't even think posed any real risk to us. Now in this country, we have 45,000 people dying every year. That's a study, a peer-reviewed study, released by Harvard Medical Research Team and published in the National Health Policy Journal on September 28th. 45,000 people a year. That's 15 9/11s that in this country are dying so that a few people can make a profit. Now, as a veteran of the armed forces and knowing that there's somebody killing that many of my citizens every year, it makes my stomach turn, and that they're the real enemy of the people. They're the real danger to this society. 45,000 people a year dying, municipal budgets blowing up because we have cities paying private insurers to insure our police officers and firemen and school teachers and city workers instead of a single payer plan. Car insurance is through the roof because we pay for taking medical care out of that. A single payer system would save money. This country spends about twice per capita per person what every other country spends, and we have 45,000 people a year dying from that. 62% of all bankruptcies in this country are a result of medical bills. There are no known medical bankruptcies in any of the countries that have single payer systems. 80% of those people that went bankrupt were insured by a company like WellPoint or Excellus when the onset of their illness or injury occurred. These people are falling through the cracks, and they're not falling through accidentally. They're being pushed through the cracks so that we can push corporate profits up, so that Wall Street investors can make money off from the health and well-being of our people. And it's time to stand up and fight back against that as a country.